Good morning, guys. I hope you're having a fantastic day. Today is Friday, June 18th. We're just starting on our way to the surgeon appointment, consultation, whatever. It's between 2 and 3 hours, so I have my heating pad on my back right now, and thankfully I'm able to plug it in the car, which is pretty awesome. So we're just stopping for lunch because I eat super early, my lunch, so everybody's kind of accommodating me, thankfully, which is very nice. Both my parents are coming with me to the appointment since, it is a rather large appointment. So I will update you guys. I'm probably not vlogging, obviously, the appointment, but I will let you all know either later today or tomorrow how it went. Hey guys, it's Monday, June 22nd. I ended up not vlogging over the weekend because I needed to recover from the 6-hour round trip to the surgeon's office. It was just a lot, and we got a lot of information in a short period of time. So I just kind of, needed to take a step back and process things on my own before picking up the camera and then reprocessing with y'all and then probably processing again another time. So that's what we're doing now. So I wasn't actually told their COVID-19 policies or anything going into this. So both of my parents did come with me, which was definitely a good idea. However, both were not able to come into the room with me to see the surgeon, which, it is what it is. So my mom came in with me to just listen, and help out because I don't remember a whole lot of stuff, and I rely so heavily on her memory, to be honest with you. And she is my number one caregiver, which is why she came in with me instead of my dad, because she's just the one who's with me more often, and she's used to navigating these appointments with me. So anyways, moving on. So initially when the surgeon came in, she was kind of like, okay, well, what symptoms are you having from your Theo? Which Theo is short for the Pheochromocytoma or whatever or another. It's about this big, the name of my tumor. I will put it in the description. This time I'm actually leaving myself a note. This way I put it in the description because I think I forgot the last time. So, Theo is short for it. And I started rattling off symptoms. And then I stopped myself. And I was like, you know what? I am actually really medically complex. I'm not 100% sure with some symptoms, if they're tumor related, hormone related from the tumor, if it's adrenal insufficiency stuff, if it's another disease that's just ticked off by the tumor, or hey, maybe another disease is just flaring for the heck of it. And to my surprise and delight, she actually looked at me and went, I already know you're medically complex. I actually have a few questions about your EDS, your Ehlers-Danlos syndrome, if you don't mind. And I was like, oh my gosh, this is awesome. So we definitely got off to an awesome start in this appointment. She had some knowledge of EDS, and she was willing to listen and to learn about it, which was just such a relief. She already knows about adrenal insufficiency because she does work with a lot of patients who have Theos in or near the adrenal glands, because that's her specialty, are Theos, this type of tumor, and removing them and all that good stuff. So she didn't just take her knowledge and go, this is the way we're doing it, which was definitely something I was a little bit nervous about. She goes, well, this is what I would typically do with a normal patient. This is how we would work their steroids right after. But for you, I'm going to call your endocrinologist, and we're going to work together and figure out how many steroids you need, how much in steroids you need and for how long, because she goes, I don't want to under-medicate you and cause more problems, because under-medicating somebody with adrenal insufficiency after stressing out the body that much, it can become deadly. So it's definitely a big relief for me that she wants to talk to my endocrinologist, because the plan she gave me is definitely different than the one that he had mapped out. So it's definitely in my best interest that they talk, and I'm super happy about that. She actually let me see my tumor, which was kind of exciting for me. I do like to see my own scans and be really involved with my own care. I just think it's important, and I enjoy learning, and it's just kind of neat to see everything. So like my one adrenal gland, of course, is probably like about that big, like the size of my pinky, maybe, if that. It's like this little squiggly line. And then on my right side, I got this big circle, and I was like, oh my gosh, like I didn't expect it to be so round, by the way. It was very round. And I didn't expect it to look that big. Like, I know it's only, I think it's like grazing 4 centimeters, so it's not like huge, but I mean for an adrenal gland tumor, it's a good size. So that was definitely really enlightening to see. And then of course she pulls up my scan and she's like talking about like all these different things and what needs to be done, what needs to be clamped, and this, that, the other thing. And then she's like going to show me something, and she goes, oh no, that's weird. And I was like, after I heard that's weird, I was like, well, you got my scan then. That is definitely mine. It's not normal. It turns out there's I believe it's the adrenal vein that is extremely important in this surgery, and she cannot see it on my MRI at all. Her guess was something with dehydration. Totally possible. I don't know. So she's ordering a CAT scan. This way we can kind of get that figured out a little bit before surgery. The other really major thing is, and this was totally not expected, I am not stable enough for surgery, guys. So I have a couple weeks easily to be waiting, and that's if everything kind of goes quickly, you know what I mean? So my heart is actually the issue. I am way too tachycardic, which was kind of a surprise to me because my tachycardia so often has been pushed to the side or under the rug. Like it's kind of no big deal, you don't have to worry about it type of a thing. So I was definitely shocked when she told me my heart rate was the reason I can't have surgery. I'm waiting to hear back from doctors like which medicine we want to use, because the medication I have on hand will drop my blood pressure, and if we're dropping my blood pressure too low, we're going to have problems with the POTS, and the combination of meds I was told could definitely aggravate my POTS, so I'm not comfortable like just messing with it on my own. It's like as needed is how it's prescribed right now, and I'm totally not touching it until I hear from my cardiologist or endocrinologist, whoever wants to call first, to hear from them like specifically what do I need to do. So that's definitely the big thing right now. So we're just waiting on more appointments, and then I see her July 1st. So I have now a ton of appointments this week, so I'm going to probably be vlogging a lot. So of course we went over all my history and all that good stuff. I don't believe that I've really gotten into this much on my channel. Like, to be honest, if I talked about it, I've probably briefly mentioned it because I've never made a big deal about it. I have a pretty large history of having cysts and growths or like tumors. And everybody's kind of called them like different things. So my first growth actually appeared when I was 9 years old. And they said that I had a ruptured cyst. I had no cycle or anything like that. And my mom was like, that's kind of weird. That's totally not normal. Girls don't just get cysts or growths like out of nowhere at 9. And it was several years before I ended up getting a cycle. So that was kind of like a little bit okay. Like, that's weird. But again, nobody said anything. It was no big deal. So moving on. As I was a teenager, I ended up with a lot of cysts, a lot of polyps, a lot of growths, a lot of weird stuff, obviously. You've heard my story, part of it. So I had polyps in my sinus cavities. They were never tested. None of these tumors, by the way, were ever tested, but I was assured by physicians, multiple physicians, me and my family, all of them are completely benign. You have absolutely nothing to worry about. Okay, like as a teenager, what are you going to say? Like, you're not going to argue with them. You're not going to be like, oh, it needs to be tested. Like, why would you say that? You know what I mean? Like, now, looking back, I'm like, oh, it should have been tested. Like, that's just stupid. It's ludicrous. There's no excuse. But back then, we didn't know any better. Honestly, none of us did. So I also had a really large, and this is the one she really thinks was definitely a Pheo. I had a large cyst on my right ovary, and it was leaking. However, this made me so upset. I went through, I can't tell you how many CAT scans, ultrasounds, MRIs, everything. Nobody saw any tumor or growth. Then I went in for a laparoscopy, exploratory surgery, and they found this huge cyst. It was like the size of like a grapefruit. It was ridiculous, and it was leaking. I was told if the thing decided to rupture, I would have lost all my female organs. Okay, I mean, you can live without them. It's not ideal. And then in addition to that, I would have lost my bladder. I mean, think about that. At 14, to lose your bladder over something that is totally preventable. So that was really scary. I mean, at 14, you don't expect to deal with that. Nobody biopsied it. There was issues I found out later with the doctor's, how do I say it, credibility maybe. I believe her license had been taken away. So yeah, that's a whole different monster that we're not even getting into. But my tumor was never really, I don't believe, looked into properly that time. And this current surgeon does believe that that was a Pheo, and she did tell me that it is seriously a miracle that I was able to pull through surgery due to the way that my blood pressure and heart rate have been for years. I've had issues with both of them for the longest time, honestly. She said most people in my condition, they either don't make it, period, or they have a stroke, a heart attack, or another cardiac event. So, like, I really didn't think about anything like that, obviously. Like, I never really thought. And she goes, for all your surgeries, honestly, because you've probably had so many Pheos, you're lucky that, like, you recovered so well. And honestly, I don't recover well from surgery. Like, I recover very, very slowly. My first surgery, it was supposed to be a 2 to 3 day recovery. 6 months later, I was still struggling. So that's just perspective. Back to my cysts. I also have had growths under my arms, like to the point I couldn't lift it. It would be like under the entire armpit. I know, super gross, but reality. I've also had them in my legs. I've had growths and stuff on my bones, which was found in an x-ray. And I was, again, told they were no big deal, nothing that we do. We don't even need to monitor them. And then, of course, I don't know if you've all noticed, that is my friend. I've had that since I was 15. It swells, it's changed, it's grown. They haven't really said what we're going to do about that one, so we'll just see. And then, of course, the newest one. So those are, like, my known history of, like, growths and whatever. So I actually think I'm going to put this video in 2 parts. So I'm going to end this one in a couple minutes. I think, though, those were, like, the major points. She talked about that if they're unable to visualize everything properly, that would cause them to honestly open me up. And the way that things are looking, I am a little bit nervous that they might have to end up opening me up for surgery, which would not be ideal, but it's also not the end of the world. I'm very pleased with her as a doctor. I'm like, it was just a wonderful appointment. She really thinks that, like, my story is pretty amazing. So, I mean, that was kind of, like, cool. She also said my doctor took excellent notes. She thinks that he's a compassionate doctor and that he really cares about me as his patient. And, like, this is a doctor who I've had, for the most part, always a good experience with him and, like, good open communication. But to hear that from another doctor, that was also just very validating. I was like, you know what? See, I knew I kept him around for a reason. You know what I mean? Like, he's a great guy. And I'm just super, super thankful to have him on my case and as my doctor, you know. So I think that's it for this. So I totally forgot to actually mention that I need my heart rate to be a little bit lower, because initially when we do surgery, we're going to be basically taking off the tumor. And when the tumor gets really mad, it's going to throw off all these additional hormones, and my body needs to be in a spot to kind of accept that. And it's going to freak out, like, there's no way around that, but we need me to be as stable as possible. This way we could do the surgery as safe as possible and hopefully avoid any major, like, cardiac events or strokes or anything of that nature. So I wanted to mention that. I'm sorry I didn't do that sooner.